want to look at another method which is used for surgery. This is used for surgery or could be used for biopsy. You understand? So it's surgery of biopsy, and this is what is known as the cold knife conization. Cold knife conization. So conization is more of like you are trying to like do an incision, and this incision is in the shape of a cone. Do you understand? So cold knife conization, you know. So the surgical procedure is used to remove a cone-shaped section of an abnormal tissue from the cervix. It's both diagnostic. You can use it to now have some tissues so that you can be able to send it to the lab to confirm something, or you can use it for treatment. Okay, so usually use it for women that have high grade cervical intraepithelial neoplasia, so the type 2 or type 3, or when cancer is suspected but you haven't actually confirmed this cancer. Okay, so purpose of the cold knife conization is to diagnose or treat precancerous lesions, to remove tissues that extend into the endocervical canal. Can I see? So if I just do that cold knife conization, I've removed everything. I've removed all the tissues. You can pause to observe this, right? Then to also treat early stage cervical cancer. Okay, so procedural overview: a scalpel is used to excise a cone-shaped wedge of the cervical tissue, including the transformation zone and the squamo-columnar junction. So the tissue is sent for histopathology. Of course, any abnormal tissues you remove, even though it was meant for treatment, you have to, you have to go into, you have to send it to the lab. All right. Then hemostatic sutures are placed because you have to control bleeding. So risks and considerations. All right. So you can have bleeding, you can have cervical stenosis, you can have cervical insufficiency, you can have infertility issues coming up after the surgery. So recovery is just mild cramping and spotting for days. Avoid intercourse for about a month, okay, a month plus. Then you follow up, still testing you for human papilloma virus infections.